Okay, so before we start the shoulder evaluation, I first want to give my response to the musculoskeletal ultrasound video. The musculoskeletal ultrasound can be used to compare muscle tissue and joints bilaterally to detect abnormalities. When viewing the ultrasound for tendons, the parallel collagen fibers are hit by the beam of the ultrasound and then produce echoes so that the image can be seen. The collagen fibers in the image of a musculoskeletal ultrasound can be made of alternate hypoechoic and hypoechoic lines that continue all the way across a tendon. If the image of a tendon seems to be black and hard to see, you probably need to tilt the bottom half of the probe to fix the angle so that the beam is hitting the tendon at a 90-degree angle. The collagen fibers in a complete Achilles tendon rupture in the ultrasound image will look incomplete with the continuation of fibers being broken by a giant black spot known as a hematoma in the pattern. There are many advantages when comparing the use of musculoskeletal ultrasound to an MRI. The advantages of an ultrasound is that the resolution is better for an ultrasound compared to that of an MRI and can use bilateral comparison to distinguish abnormalities. In addition, the probe of an MRI can use bilateral comparison, the probe of an ultrasound can be placed precisely on the part of the limb that hurts. That being said, there are some disadvantages when using ultrasound compared to an MRI. An MRI is better at viewing the internal derangement of joints, such as the displacement of an articular disc. An MRI is also superior when it comes to viewing bone marrow abnormalities, such as tumors, fractures, and edema. Okay, now with that done, we can begin the shoulder evaluation. So first things first, I'm going to take a past or present history OPQRST sample. OPQRST stands for onset of the event, provoking factors, quality of pain, region or radiation of pain, severity, and then time. And then sample stands for signs, symptoms, allergies, medications, past medical history, last oral intake, and the event of when the injury occurred. Okay, so first things first, I'm going to inspect for swelling, discoloration, or deformity at the shoulder. Then I'm going to evaluate the posture of my patient. So stand for posture.
I need a new hip. It's not gonna,
Okay.
It doesn't get better than
Okay, then I'm going to look at, are the shoulders equal? So put your, just hang your hands, be relaxed. Hang your hands relaxed. Okay, that's pet posture. Do the shoulders are even atrophy or hypertrophy? So is one shoulder bigger than the other or more stronger? Are your arms hanging equal? Okay, is your scapulae winging in the back? Okay. Okay, now we're going to do some palpation. So first I'm going to palpate the clavicle, the cervicolavicular joints, and then I'm going to palpate the acromioclavicular joint right here, the humerus, head of the humerus right there, your bicipital groove right there, the acromion process, six right there, your coracoid process, which should stick, trying to find it right there. Can you turn around? I think it's a lot easier. Okay, now these are the parts of the scapula. So, also the parts of the scapula, but more of the parts of on the posterior side. The inferior angle, the scapula, the medial angle of the scapula, the spine of the scapula, the lateral border of the scapula, medial border of the scapula. I think that is all. Okay, you can turn around again. Now I'm going to palpate the muscles. So we have the anterior deltoid, middle deltoid, posterior deltoid, your pec major, so your pec minor right there. Turn around again. So trapezius upper, middle, lower, the rhomboids, so minor, major, the latissimus dorsi, so it's like this sheet muscle, the serratus anterior.
That tickles.
Sorry. Okay, and then right here, so this is part of the rotator cuff muscle, the infraspinatus, supraspinatus, and then teres. Sorry, teres minor right in there. Turn around. And then your subscapularis, you can't see it, but it'd be on like the front of your scapula, like right under your pectoralis major. Okay, now we're going to do some range of motion. So, and we're going to do active. I could have you help you and do passive, but we're going to do active. So, flexion of the arm, that should be 180 degrees. Extension, 60 degrees. Abduction, so away from the midline, that should be 180 degrees. Adduction, so towards the midline, like that, 45 degrees. Horizontal abduction, so outwards, and then horizontal adduction, inwards. Scapular elevation, so elevate your scapula. Scapula depression, so lower it. Scapular retraction, so retract it. Scapula protract, so like a push-up, like protract. Okay. Internal rotation, so do this. Internal rotation, so towards. External rotation, this should both be 90 degrees. And then a thing to note is that internal, external rotation can also be known as medial rotation and then lateral rotation. Okay, so now we're going to be doing some resistant range of motion. So remember that first thing I had you do? Flexion. So all the way up.
Move.
Sorry. So, no, remember this one? This one. Look at me. Like that one. Okay. I feel hold on to you. So up, 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 up. Okay, so, and that's working your pectoralis major, your anterior deltoid, and your biceps. And now the opposite one. So backwards. So extension up, 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 up. That is working your latissimus dorsi, your teres major, and your posterior deltoid. Okay, and now abduction. So away, up, 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 up. That is working. That is working your supraspinatus, your middle deltoid, and now adduction. So now towards yourself. That is working your pectoralis major, latissimus dorsi, and now internal rotation. So remember that one, and now just go towards yourself. That is working, this is a lot. That is working pectoralis major, subscapularis, latissimus dorsi, teres major, infraspinatus, and teres minor. And then opposite, external rotation. That is working, okay, push me down. That is working anterior deltoid and pectoralis major. And then remember horizontal abduction, adduction, so like this. So abduction, this is working your posterior deltoid, latissimus dorsi, and teres major. And then towards yourself, that is working your anterior deltoid, pectoralis major, and coracobrachialis, which I also forgot to palpate. It's right there. It's with the biceps. And now, for these ones, I'm not going to have you do resistant range of motion. I'll just have you do them yourself.
Oh my God.
So, sorry. So for scapular abduction and like upwards, so like bring it away but then upwards. Okay, that's working your serratus anterior. And then shoulder elevation, so elevate your scapulae. That is working your trapezius, your levator scapulae, and your middle trapezius. I also forgot to do the levator scapulae. It's right here. It helps elevate the scapula. My bad. And then scapular adduction. So like bring it to like pinch your shoulder blades together. That's working your middle trapezius and your rhomboid major. And then scapular depression. Okay. Depression and abduction, so kind of like downwards and then backwards. Okay, well, that's kind of tough. That's working your trapezius. Sorry, your lower trapezius. Okay, and now we're gonna do some motor. So deltoid, so bring your arm like this. So deltoid, wrist extensor, so extend your wrist. And then C7, so extend your tricep. And then wrist flexors, so flex your wrist. And then extend your fingers. Okay. C8, finger flexors, so flex your fist. And then T1, finger abduction, adduction, so like, yes, just like that. And now, okay. Now for sensory, look like that. C5, anterior central lateral arm. C6, thumb. C7, middle third finger. C8, little finger. T1, anterior central medial forearm. And then this is the C5 biceps reflex test. So just like that. I'm gonna just rest your hand on mine. Test the biceps. And then the brachioradialis tendon. So remember that brachioradialis there. So I'm gonna do this. Test the brachioradialis. And then the tricep tendon. So bring your arm back like that. Like this. You do this. And then I'm going to test your triceps tendon. And now, okay, I'm going to take a radial pulse. So I'm going to hold this for 20 seconds, or sorry, like 15 seconds, and then multiply by 4. Oh, I have a watch, sorry. Let's start over. Okay. Seconds. Okay, and then that was 22 to, and you times it by 4, that's 88. You have a strong / like normal pulse rate. And then a recapitalization test. So I'm going to squeeze the nail and color should return within 1 to 2 seconds. And then I would compare bilaterally. Thank you.